Hey guys, it's Dr. Peevler again. So I just wanted to make a quick video. When I go back to Florida tomorrow, over the next couple days, we're going to be producing a new video on immunity, COVID, and things we can do. And so I just wanted to give a little rant, a little hospital rant, not an angry one, but just a public service announcement. So I have admitted, I don't know how many patients with COVID-19, since the start of this pandemic, New York, Indiana, West Virginia, Kentucky, and I have, because I'm a functional medicine doctor, I know the role that immunity and vitamin D play. So I've been checking on almost every single patient that I've admitted over the past year, and I just happened, I admitted a lady last night, and unfortunately, when I left the hospital, her vitamin D level wasn't back yet, so I didn't have the answer. But I went in and looked today in the computer, and I saw that it was 9, and I just see the literature that I've been pulling, getting ready for this video that we're going to be making here in a couple of days. And there's substantial literature because we didn't have a lot of therapeutics for or known therapeutics for COVID. We even the mainstream medical people were looking into alternatives. So there's actually quite a few papers on vitamin D, and that's what we're going to be covering in the next couple of days, going through those literature and going through the results and showing how important it is. But I'm just saying that I've been on the ground, like in the trenches, in New York and in these different states, admitting patients with COVID, sick patients with COVID. And like I said, I check vitamin D levels on everyone. I think I've seen maybe one patient, or at most 2 patients that have a normal vitamin D level, and I haven't seen one that has the vitamin D levels that I would prefer to have in my patients. So this is big, and it's something. It's an easy modifiable risk factor. Getting it. Obviously we live in Florida. My patients, and we live in Florida and Miami, but getting adequate sun, and if you can't get sun, unfortunately for the majority of the people probably watching this video, who live outside of South Florida, getting adequate supplementation and having a doctor who knows what the adequate level of vitamin D level that you want to have in your blood, and regularly checking it, because this is something you can do to help not only prevent getting COVID to begin with, but also to prevent severity, hospitalization, ICU stay. So we're going to go over the literature here in a couple of days when I get back to Florida. But I just wanted to tell you that I just had another patient last night. Vitamin D level came back 9, ultra low, and they're sick enough to be in the hospital because their immune system essentially isn't working. So stay tuned. When I get to Florida, we're going to be producing a cool video going over the papers. So stay tuned.